The following program is a paid presentation for American Medicine Today and the Bonatti Spine Institute. The information and opinions expressed are solely those of American Medicine Today and are not the opinions of the station, its affiliates, management, or employees.
Welcome to American Medicine Today, presented by the Bonatti Spine Institute, the world leader in advanced spine surgery, featuring the internationally acclaimed inventor of the Bonatti spine procedures, Alfred Bonatti, MD.
Hi, I'm your host, Kimberly Brummel, and welcome to American Medicine Today, brought to you by the Bonatti Spine Institute. Today we'll discuss the difference between different types of spinal procedures and how facilities aren't really offering anything compared to the Bonatti spine procedures. We'll also speak with a patient that has been living with back pain, and we'll have a one-on-one discussion with Dr. Bonatti about the Bonatti spine procedures and why you should know the difference of so-called minimally invasive procedures provided by other spine centers. Dr. Alfred Bonatti is credited with inventing and patenting new techniques and tools to develop a highly effective and revolutionary minimally invasive spinal surgical procedures known as the Bonatti spine procedures. He and his team of medical professionals have performed over 45,000 procedures over the last 30 years, and a recent 5-year patient survey has shown an incredible 98.75% immediate patient satisfaction rate.
Initially in my life, when I graduated, I did work in neurosurgery and after in orthopedic surgery that required training in open back surgery. During these procedures in back surgery, we did every different procedure. After that, in my own practice, I started to do some open back surgery, but the satisfaction of the patients and the satisfaction of the doctor was very poor. So I looked into possibilities to develop something that will be different and that will create less trauma and develop better care. The Bonatti patent procedures are procedures designed specifically with a mind to target specific areas of the pathology. So every time when each procedure you can address and you can deliver a direct treatment to areas that are specifically affecting the patient. When you talk about other procedures, they are more global, more generalized. They don't really specifically target the areas where the pathology is located. If the patient goes to sleep, is an uncooperative partner, he will never participate on the decision of the surgery. When the patient is awake, is very much a total full partner. He's telling you where the problems are and is guiding you on the areas that he has most of the discomfort, the pain, or where the abnormalities are located.
Neck is good now?
So that way allows you to have incredible good results. The recovery time of the patent Bonatti procedures is almost non-existent. The procedure is performed in the operating room. The patient needs to express a total removal of the areas where the patient was priorly hurting.
Go to your back now and tell me if the pain is gone.
So they are totally free of pain on the areas that we treat immediately after the surgery, what allows us immediately to treat the patient with activities that they are normal. So we try to push to normal activities the next day after the surgery. The target to treat these patients is to return these patients totally to normal life. That means they need to be totally free of pain on the back and pain on the extremities so they can perform their jobs or their normal activities, games or sports or work.
We'll be right back with our Back to Life segment highlighting Debbie Pearl. We'll hear about her remarkable recovery with the Bonatti spine procedures.
Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.
Welcome back to American Medicine Today, presented by the Bonatti Spine Institute.
At the Bonatti Spine Institute, all of our procedures are performed here at our 11-acre facility, from your initial consultation and exam to x-rays and MRIs. All surgeries are performed in one of our 3 surgical operating rooms, and recovery is just steps away. This allows the surgeon more access to their patients and allows you to go home the same day. Here's just one of our ordinary patient experiences.
Hello, my name is Debbie Pearl. I'm 62 years old. I'm a professional writer. I write books, usually how-to books on marriage or on homeschooling. This is the last one I just finished. My books are in many different languages. But there came a time in my life just about 2 or 3 months ago where I just couldn't sit at the computer anymore because my neck hurt so bad. My neck had actually been hurting since I've been in my early 20s, but it had progressively gotten worse to where it was just like, ugh. I'd tried every kind of chiropractor you could imagine. I'd been to neurosurgeons. I don't do well with medication. So in January of 2014, I said, I just can't take it anymore. I can't write anymore unless I can get over this pain. And so I started looking on the web, and after finding a place in Tampa, which I decided not to go to because they didn't have neurosurgeons, I found the Bonatti Institute. So I flew down there just to check them out. I met everybody, spent time talking to the different patients, patients going into surgery, patients that had been finished with surgery, and I was impressed with what I saw. So I signed up, and 2 weeks later I was down to have my own surgery, and it was amazing. It was amazing. I woke up from surgery and I felt like a different human being. The next day it was even better. It's been 4 or 5 weeks now since I had my surgery. I feel like I've got my life back. I feel like I lost like 25 years of being old, and I'm back to being able to do so much, move. The greatest thing is sleep. I'll never forget, I was home about a day when I woke up and I realized a whole night had passed. And I wasn't even aware that the night had passed. I'd slept through the whole night with no pain. And it was just like, I told my husband, I said, I'm back. I'm ready to start really writing. So I'm thankful for Bonatti Institute. I'm really thankful.
Well, it's amazing to see somebody who is sick and is without hope and has situations where they were already told that nothing can be done, and we can correct that.
He'll go in to a nerve and just slightly clear the area around it so that it has a flat bed to lay on, remove edges around it that we're talking about very, very small spaces, and a very, very steady hand, which is quite amazing.
It's very happy. Our win percentage, our success percentage is very high, much higher than I had before I came here when I thought I did good minimally invasive surgery. That's a way to, it puts a little bounce in your step going home when you're tired. And I look forward to coming in the morning when we have a whole new week's worth of challenges.
I think we see that a lot as far as many patients have been to several doctors, several different methods in trying to deal with their problem, and oftentimes on a large amount of medication. and to take those patients and help them by relieving the pain, and thereafter being able to detoxify off narcotics and then go back to being productive. I think that's very rewarding.
Yeah, the fun thing about working here is our patients all get better. When you deal in pain management, which is my specialty here, mainly I'm in, patients a lot of times are on narcotics all their life, they're on pumps, they're on stimulators. We don't get that. Our patients, when they come here a lot of times on heavy duty drugs, and when they leave, they're off those. Or if they come here on a pain pump, by the time that they're done here, the pain pump's turned off. So, you see a patient, and I said this a million times, they have a frown on their face, a furrowed brow when they come in, and when they leave, they've totally done a personality change. You see them smiling because they're walking and they're without pain. And it's an incredible thing. It's just a luxury to have that as a physician, and to experience that every day. I'm so lucky to have that.
When they come here, they've been in pain for decades. Not for weeks and months and years, but decades. They have not been able to participate in life. I guess I feel their pain. So when they have a relief from the pain and they're able to walk, they're able to lift up their grandchildren, they're able to return to school, they're able to get back to work, to being productive, then you're talking about making a tremendous life change and impact on someone's life.
Every time that I walk in the operating room, when I am scrubbing my hands, I always thank God for the opportunity to do this. And it's very unique, that feeling, and you need to appreciate it. The same like the patient. When you are doing this surgery, the patient appreciates that. And it's amazing how easy the word God comes in their minds.
All my pain is gone, gone.
Today I am totally pain-free. Nothing. No after effect.
I'm pain-free, and I have had to take any pain medication.
Today I am pain-free for the first time in over a year, and it is so awesome.
I only wish I'd known about it earlier. Right now, I am completely without pain.
Sitting here in this office right now, pain-free, eager to enjoy the rest of my life.
I am feeling great.
I feel 100% better, like a new person.
Today I feel absolutely fantastic. It's just incredible, the relief I feel right now.
Today I'm completely pain-free.
During the procedure, I literally felt the pain melt away. It was fantastic.
I feel so good.
It took care of my headaches instantly.
It's incredible. It's really incredible. It gave me my life back.
It's just wonderful.
I feel fantastic.
It is just absolutely amazing.
So I'm hoping to be climbing hills in a few weeks.
And I just feel awesome. I just feel like I have a new life. And I just cannot thank Bonatti and all the people here, everything that they've done and built, and their expertise, and it's wonderful.
Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.
Welcome back to our final segment of American Medicine Today, featuring Alfred Bonatti, MD.
You said other facilities give minimally invasive a bad name. How are they different?
Well, the terminology minimally invasive really means a very little damage created. So that opens an enormous field of different type of approach. And some of those ones are not really very intelligent, and some of those ones are not really very accurate, and some of those ones are not really very effective. So to be able to correct the problem, you really need to identify the problem, know where the problem is located, get to that problem, and correct that deficit or that abnormality. When you try to do it in different way, for example, people talk about a discectomy using laser. This is something that we use in the 1989, 2000, 89, 92 period of time, because we were developing the technique. But you know, that is something that we developed initially. But the problem with that is we then learn the type of approach that only goes to the disc will only be suitable for a very small amount of population, and usually very young population. So when you try to apply that technique in generality, you are doing two things. You are doing a disservice, and you are costing money to a healthcare industry. It needs to be by a specific knowledge and prepare group that they know what they're doing. And if they don't, then you're going to have frustration, poor results, complications, and probably you are going to have very unhappy patients. Well, the next thing that's going to happen is those patients are going to go to a facilities that they know what they're doing, or they are going to go frustrated to open surgery. What is also a bad direction, because open surgery in certain cases help, but with the technique and technology that we have today, with the Bonatti techniques, the Bonatti instrumentation, and the Bonatti procedures, we can address these things really very accurate, very extremely accurate. It's the same thing that when we start doing knee surgery. Initially, we need to open the knee, and then we use the scope. But the people who was not well prepared tried to go inside of the knee. They create problems on the cartilage. They create problems on the bone. They damage the joint. Till experts come, and when the experts came around, those things were minimally affected, and the results, like today, are better and better. And that is why I criticize. And one of the signs of a mediocrity is when you start to have bad results, then you start to acquire other different type of approach. You start to use techniques, or you start to use some sort of injections on the discs and things like that. That they are very, very much experimental in that they are not really offering any results, but they are creating expenses on the healthcare industry. And that's why I said that you need to be very careful when you elect the surgeon who is going to do your back, because probably you're going to end doing more surgery later.
I've noticed that other quote-unquote imitators out there try to blur that issue, and they try to pretend that they do what you do, that they offer the Bonatti spine procedures, but let's face it, aren't they exclusive to this Bonatti Spine Institute and their patented procedures?
Yeah, the procedure was developed here almost 20 years ago. Was every single day we create a new type of we become more perfect. the mind of the surgeon and the hands of the surgeon encounter a lot of things in the procedure that even if you are doing every single day the same thing, every patient is different and every problem of the patient is different. Even if it is the same nerve in the same location with the same pathology, with this whole thing, suddenly you go inside there and you have an abnormal vascularization you need to deal with, or you have a nerve that is being twisted different than you need to deal with, or you have a disc that is calcified you need to deal with. So it's a learning. It's a life learning procedure. It's not something that you learn today, you can do it tomorrow, and can repeat all the time. So if you learn wrong, then you do wrong. And if you continue doing wrong, you continue doing damage.
And a recent 5-year study, or survey rather, talks about a 98.75% immediate patient satisfaction rating of your procedures.
We are recording this for the last 5 years because we always want to know if we're doing a good job or not. And the reports of these patients is tear-jerk because they tell you, they appreciate you, they tell you that you changed their life. They talk to you like really you put different direction on their future. It's extremely humbling, and at the same time it's extremely powerful.
So I think what differentiates you truly from these other quote-unquote minimally invasive facilities is that you get to the root of the problem. You exactly find the pathology, you resolve it instead of just treating a symptom, and that's why Bonatti succeeds where others fail.
I agree with that, but you know something also is the responsibility of the patient. One of the responsibilities of the patients is to look where this person was trained, what type of training he has. Don't go have surgery on your spine by an anesthesiologist, you may have a problem. Don't have surgery in your spine by a radiologist, but you may have a problem. If you're going to do, at least be sure that the guy is a neurosurgeon or an orthopedic surgeon with proper training. Like everything in this world, you have people who love you and people who hate you, and sometimes those things can be detrimental on the patients to elect the proper individual. Right. But what you need to do is you need to go ahead and see how long this individual is working, how this individual performed, how many cases this individual did, what type of training he has, and I think you're going to be in good hands.
So Dr. Bonatti, you're actually talking true patient resolve versus just a patient that had a procedure performed. And we always get to hear from the patients in our Back to Life segment. I think it's incredible. I don't know how you feel about it, but again, that 98.75% is true patient resolve of pain, not just the fact you performed a procedure.
Well, you need to really look at this procedure with very careful. You're talking about back to life. Really, this is back to life. And why is back to life? When you have an injury to a nerve, if you do a sloppy correction, you may remove the pain and the patient may feel okay, but it's not back to life. Is with occasional pains, the things don't work well, they cannot go back to work, they're miserable one time, the other time a little bit better. That is not what we do here. Our goal is you need to look and act like a young person again. I have people that they come here in a wheelchair, and practically they, for many years, and they gave up really on life. They are practically sitting, waiting when they're gonna die. And I understand that, because once you lose two things in life, you cannot lose. You cannot lose beauty in your soul and in your spirit, and you cannot lose mobility. If you have mobility and you feel internally young, I don't care how old you are young. So one of the things that you need to know is this procedure will correct two problems. First, will correct, let's put aside the pain. That is corrected. But it's going to correct the integrity of the nerve. The nerve is going to be so free that it's going to be recovered again. So the power of the nerve is going to be effective again on the muscle. So the muscle is going to recover. So these individuals that they go and they say, I cannot climb stairs anymore, they will.
So what you're saying is you don't need 7 reasons to come to the Bonatti Spine Institute, just one. Bonatti succeeds where others fail?
Well, absolutely. You don't need a lot of reasons. You need one reason. You come here to get better, and that's it.
Thank you for watching American Medicine Today. Join us next time as we tackle the crisis facing American medicine today, better known as Obamacare.
Thank you for watching American Medicine Today, presented by the Bonatti Spine Institute. Please look in your local listings for our next regularly scheduled program. To hear more from Dr. Alfred Bonatti and American Medicine Today, tune into News Radio 970 WFLA, Saturdays at noon.
Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.
The preceding program is a paid presentation for American Medicine Today and the Bonatti Spine Institute. The information and opinions expressed are solely those of American Medicine Today and are not the opinions of the station, its affiliates, management, or employees.